So we are here today on the study streak for Ellen's keynotes, and so far we have studied abrotanum, we have studied ethusa, we have studied borax, we have studied calcarea carb, we have studied antim crude, ipecac, antim tart, and today is day 4, I believe. And let's continue the journey. Today's remedy, if understood well, I'll be taking only one remedy because it's vast remedy. But if you understand this remedy, you will solve 50% of your acute and chronic cases. So the remedy which we will discuss today is some key remedy of our materia medica and something that is related to all the remedies that we studied so far, whether it is abrotanum, whether it is ipecac, borax, antim crude, antim tart, calcarea carb. It is related to all these remedies. And when these remedies uh, have poor action or they have reduced action in the vitality of a patient, you can think of the remedy which is known as sulfur. So I'll be taking only one remedy today because it's quite huge, and the scope of this remedy extends from head to the toe. So the very first line which Ellen says is that when carefully selected remedies fail to act and or they fail to produce a favorable effect, you should think of this remedy. Now, whether it is acute disease or whether it is chronic disease, sulfur should be used as an intercurrent. Maybe if you have given a chronic remedy to a patient and the patient has stopped improving, you are increasing the potency, patient has stopped improving or he is at a status quo level, go for sulfur and then repeat the same medicine. You will get good result 110% because this is proved by none other than Hahnemann and also by all the classical homeopaths which we have practicing since the last 200 years. So it especially it works in acute disease. So whenever you have given epicac, whenever you have given entimtart, and you see that the vitality is not strong enough, and the remedy is very much correct, and you feel that why should I change the remedy? And sometimes initial phases of your practice where you are learning from different teachers, someone has told a new remedy and you give that remedy and you change the remedy and then you change the second remedy, you change the third remedy just because it was not working. But just give a try to sulfur in acute diseases, it is definitely going to help. If it is a chronic case, you can think of sorinum as the remedy which can be given as an intercurrent. Of course, you can think of sulfur as well, but it depends from case to case, and you'll need to individualize and find out what has been the recurring pattern in the patient which points towards sulfur or uh, you know sorinum. Now next what Ellen mentions is that complaints that are continually relapsing. So the patient will come and tell you, maybe I got better a few days ago and now I'm again having complaints, allergic cases or skin complaints or gastric issues, all these functional level cases where you feel that complaints are coming back again and again, and you will be compelled to change the remedy because you think that remedy is not working. But actually if you give a dose of sulfur and give the remedy again, it is going to help you, because changing the remedy will entirely change your track of thinking. You will go to something else, then you will go to something else, then you will go to something else, and you will mismanage the entire case. So don't do that. Give a dose of sulfur, and in cases where complaints are continually relapsing, when the patient is getting better and he is getting worse again after a few days, whether it is acute or subacute cases, this is going to help you a lot in clearing the case. Now, further, what Ellen says is that it is adapted to scrofulous diathesis or patients who have venous congestion. So, portal congestion, those who don't have the bowels clear every day, or those who are not able to feel comfortable, they have a sedentary life, portal system is congested, they burp every time, they irritate every time. Few doses of sulfur, every week or every 15 days along with your constitutional, if it is a chronic or subacute case, or if it is an acute case, maybe you can think of sulfur in the morning or forenoon to be given, and it will kind of help the patient to tone the vitality and the vital force. Next, what Ellen mentions is that it is sensitive to atmospheric changes, and persons who are, often nervous temperament like Hepar, Kalikab, and Sorinum, those who also have the sensitive to atmospheric changes. So you can think this remedy when the weather is changing from hot to cold, cold to hot, or patients are continually, traveling from some one room to the other where air conditioning is there and the other room does not have the air conditioning, etc., etc. Next, what Ellen mentions is that lean, stoop-shouldered people who walk and sit stooping, they walk like old men. Now, when you observe the patients who come and sit in your clinic, you know 50 to 60% of your case is resolved, or you can find a good clues to the remedy or clues to the rubrics and prescription from observation only. And if you see people who don't touch their backs, to the chair, and they're just, sitting in the front, although their lumbar region is supported, but their front of the upper body is, a kind of little front and bent forward. That is the stooping of sulfur. So it does not necessarily mean that every time the patient will walk with a bent gait in your clinic and enter that way. It can also mean that when they are sitting, they can't sit erect or touching their dorsal region to the back, but they will sit a bit forward, and that is where you will be able to pick sulfur from your from the sitting posture of the patient. Next, we have is children who cannot bear to be washed or bath. This is a very key symptom. Every element of sulfur, whether it is antim sulf, antim crude, whether it is calcarea sulf, hepar sulf, all these are dirty, remedies which have dirty skin, dirty appearance. So you can think of, aggravation from water in one way or the other. In sulfur, it is just a normal water, but in antim crude, you will see that it is cold water, especially. And who also have worms. The children who also have worms, and when the best selected remedy has failed. So, children who are constantly troubled by worms and you are thinking what to give, go for sulfur low potency and in frequent repetition, 2 to 3 times a day, and then follow it up with your constitutional medicine which you have thought. Definitely, there will be the worms will be ejaculated sometime or the later, or the patient's complaints will reduce because the worms have been eradicated in the stools. The children will also not take covers at the night, just like Hepar and Sanicula. And next is what we have is standing is the worst position. They will always cling to something, or try to find a support from certain, uh, you know on certain object. That is what you will always find. Dirty skin problems, I already told you about it. Hepar sulf is one of the remedies you can take. Sorinum is one of the top remedies mentioned by Ellen in the relationship. And they don't like to be watched, which I already shared. They are too lazy, they are too, people who are, unhappy type of people, so they have a sad appearance. So how will you find out all these mind symptoms in your practice. We had a very wonderful rubric workshop done in the month of February, and we undertook many rubrics and patient versions, especially where how will the patient tell you about certain things, or how will you pick up those things when when they are sharing from their case, when they are giving their case to you. So you'll pick it up in this way from seeing their expressions. And sometimes the patients are not happy when they're sharing about themselves, their life history, their case details. That is where you need to pick up sulfur from. One very important thing, if you want to master your practice, you will see a patient who has come with localized problem in the throat, and there is lot of redness, lot of congestion, and you are thinking of maybe Moxol or Lycopodium or some remedy. But if there is a congestion to single parts, it can be eye, it can be nose, it can be abdomen, it can be chest, any part of the body, lot of local congestion, there is engorgement of veins, there is uh, you know uh, no stoppage of drainage of the lymph and the venous system, think of sulfur as the remedy. It will definitely help in most of the cases. It can be eye complaints, it can be abdominal complaints, or it can be any complaints which have to do with localized congestions and kind of bordering towards inflammation. Also, you'll have sensation of burning and smarting in the eyes, or redness or vesicles in the mouth, which is mentioned. Now, I will not go into much detail, but just to understand that everywhere you will have burning, need not mention how will the burning be. It will be directly expressed by the patient. And the burning is so unbearable to the patient that when whatever fluid passes through it, whether it is the lacrimation, whether it is the urine, whether it is the stools, it will cause the discomfort. That is where you will be able to pick up, and there will be redness of those affected parts. So you will check the local parts and you will find the redness. Now, one very underestimated thing what I have seen for sulfur, many of the practitioners don't employ sulfur in cases where there is lot of fluid accumulation and you need a remedy which will drain the fluid or absorb the fluid. So sulfur is a very good remedy in those cases. Also, another remedy which you can think on those levels can be arnica and kali iode. So they are very good absorptive remedies. These remedies will reduce the surface tension and kind of absorb what is excess in secretion in that local part, and pick it up and put it where it needs to be, or drain it from the body. So to facilitate absorption from the joints or from the body parts, you can think of this remedy when bryonia or calimure or some other best remedy also has failed. You will have patients at climateric who will say that I cannot bear closed areas, I feel all the time that there is you know uh, घुटन जैसी होती है, kind of I have internal suffocation type of feeling. Those people will require sulfur. You can think of medorinum also, and they will not be able to sleep at whole night because of this complaint. Sulfur is mostly indicated for burning of the souls, but whichever patient comes to you and shares with you that I have burning of souls, just ask them during the day what is it and how is it. They will say that no, during the day it's completely normal. I don't have any problem. It's completely fine, normal. Even it can be cold, but during the night, it's the burning starts, and I kind of feel there is lot of heat which is accumulated. People who have the menopause, females who usually complain of these things. So there is again you see localized congestion to certain part, and you can think of sulfur as one of the top remedies. And they will need to put their feet out of the bed, so there is a kind of an aversion of sulfur to be in the bed at the night time, because that's an aggravation time. The remedy which is on par with this symptom is medorinum for putting out the legs out of the bed. And similarly, you will also see in sanguinaria and sanicula. So Going further, we see that there is a headache which keeps on coming recurringly, just like sanguinaria, and there will be a kind of irregularity of distribution of heat. There will be uh, hot feeling in the head and cold feet, or hot feeling in the legs and head will be cold. So this can be a very valuable sign that you will pick up when you examine the patient. Going further, in chronic cases, I have tried to confirm most of the patients about their appetite time. And if they tell you that I am hungry, an hour or two before the lunch time, like lunchtime is usually 1 or 2, and they usually feel hungry at 11 or 12, you should think of the remedy sulfur, because it has a very vague feeling in the stomach around the forenoon time, 11 or 12, and you can think of prescribing sulfur based upon that physical general, and go further. So similarly, you will also see in natrum carb, but natrum carb will feel better by eating, and also you can see the same comparison for GIT symptom with zincum metallicum, which has frequent fainting spells during the day, and diarrhea after midnight is usually seen in sulfur. So very uh, less times patients will complain that they will have diarrhea at night time. Mostly you will see that they will have during the daytime or evening, or after eating or after taking some meals. So you can think of the remedies which are indicated, but at the night time you can think of sulfur, you can think of strontium carb. If it is after midnight, you should certainly think of sulfur, or it can be after midnight, usually means after 1 or 2 a.m. So it can be 3, it can be 4, it can be 5, similar to aloes and soranum. Uh, there is another aspect, the extreme polarity of sulfur, which is constipation, and it can also have a stool hard and dry and burnt, and just like bryonia, this is mentioned, and because the local congestion is so bad and the child cannot bring out the stool, he will maybe even cry. So that is a very valuable indication that child is crying during stool. That is what will be reported by the mother. But if you'll see that there is kind of a sulfur like appearance, the child is aversion to bath, or he is very snappish and angry, and he does not want to keep himself tidy, that will give you an indication of sulfur. Going further, we see that there is cramps in the calves and the soles at night. So aggravated at night or early morning is usually seen as an aggravation for sulfur. And for female symptoms, we see that there is never well since feeling from the time of miscarriage. So we usually tend to give Sabina or Apis or Sicalcor or something like that to patients when they report to us with miscarriage or symptoms like that. But you can think of this remedy as well. And Lippe mentions that the remedy has to be given at new moon, so that the patient, the body elements align with the moon elements, or the elements of the surroundings, the environment, and give a good cure for the patient. Now in summers, everywhere, wherever you are, you will see that patients will report to you with crops of boils on the forehead, on the neck region, or on the hands, or on the body, and it will be like a cluster of boils, small small, you can say pustules, which may not break, but they are very red in color. Think of sulfur as one of the top remedies, because it gives an appearance. You need not go and take more details, because that's not going to help you. It's just going to give you all the psoric symptoms, the patient, the relatives. But if you give sulfur to those patients, you will definitely get good results. Maybe you can use sulfur 30. This is what I have experienced in especially the skin cases, especially the boils or the small minute pustule like eruptions you see in those children when the summer comes. maybe in the north India right now we still have summers going on for the next 15-20 days till the rains arrive. So if you have any case which comes to you with these complaints, think about sulfur 30 3 times a day or 4 times a day, and that will give good relief. Also, there will be another case where there will be one boil after the other, just like tuberculinum. It is there in sulfur that after the one boil is healed, you will see the other boil coming. Think of sulfur. Hepar sulfur is also another differential remedy that you can think of. Sensitivity to touch is the differentiating factor. In skin complaints, whether it is a normal skin problem or an advanced pathological skin complaint, if the patient feels better by scratching, look no further. Give sulfur or a compound of sulfur, maybe calcarea sulf or natrum sulf or something like that, based upon whatever comes from your another area of the patient, like physical generals or particulars. And if the complaints are more in the folds, you can think of graphitis, you can think of lycopodiums, especially the folds have more affinity for these type of remedies. And if there is more aggravation at night when the patient goes to sleep, more of these patients who have jaw itch, linea cruris, so these patients will usually require sulfur or dose of sulfur with your treatment which is going on. Merc is another remedy which is on par with that. Maybe a check of the tongue of the patient, or you can try to confirm from other area of the patient like physical generals, particulars, to give sulfur or Merc. If a patient reports to you from the skin specialists, try to give sulfur few doses first, and then you can go ahead with the other treatment. It will at least try to clear the exaggerated symptoms and give you a clear picture of what you need to cure, rather than showing you everything what is on the boil. Aggravation amelioration, we have shared most of the aggravation amelioration in our few minutes. But going back again, warmth of the bed, night, and standing will be worse for them. Bathing also will be worse for them, and lying on right side will help. Somehow, this is a modality which is very peculiar. Also, again, similar to phosphorus, I would say, but it is opposite of sternum metallicum, which has, in fact, sternum metallicum sleeps in a very vague position. They'll keep one leg like this, and the other will be bent, it will be like this. So it's very strange. If you can get it from a patient, from any relative of the patient telling you about it, you will be able to pick it up. But mostly we always keep seeing patients who sleep on their abdomen or right or left side, nothing more peculiar. uh, yeah, so we have a few questions on YouTube and Instagram. I'll pick it up very soon. So, for sulfur, you see that the remedies compared with aloes, one of the very strong portal remedies, liver remedies, and sorinum. And if there is abuse of metal in any patient, so you can think of this metal remedies or metal compounds have been given to the patient. You can think of this remedy. It is similar to calcarea carb, lycopol, sulfur, sepia, of course, sarsaparilla sepia, of course, and there is a trio which we need to always follow. The trio goes like sulfur, calcarea, lyco, or sulfur, sarsaparilla, and sepia. So if you follow this order, you will be able to give cures to patients, in a good way rather than zigzag way or haphazard way. And you already know that aconite is the acute of sulfur, sulfur is the chronic of aconite. Taking the questions, in acute cases, when symptoms relapse, how many doses we should give. So I have always seen that giving sulfur 1 or 2 doses in between the treatment which is going on. Like if I have given ipecac 1 hourly or 2 hourly to the patient, I have given sulfur 200 if it is an acute case. And if it is A chronic case, I have always given 30 or 200, depends on the vitality. Uh, Going to another question which asks about what dose in such cases who come from skin specialists, right? So I have always chosen to give 200 one dose, or maybe twice a day for 2 days, and then wait for a week or two before the symptoms settle and give you a clear picture of what happens, and then proceed with the treatment. So there is a thought amongst some classical homeopaths that one dose of medicine is enough. Everyone practices in their way. Maybe to hammer the vitality, if I feel that multiple doses are needed, I will give it twice a day for 2 days or 3 days. And if one dose may be enough in some chronic cases where things are going well, just one or two symptoms are remaining, and maybe the constitutional remedy is doing good work, but we just need that final push. One dose may probably help rather than giving multiple doses. So I hope coming to end, and we will take a leave today, and I hope everyone is learning little bit or a bit more from the Allen's keynote study streak. We plan to continue this and finish all the remedies from Allen's keynotes. I have not kept the linear fashion, the alphabetical fashion of the remedies, because homeopathy is best studied in comparison and differentiation rather than in an alphabetical manner. So we'll cover all the remedies. There are around 190 or 200 remedies in Allen's keynotes. We'll cover all the remedies, but we'll cover it in phases where they are related to each other. So stay tuned, and I guess it's time to call for a break till tomorrow, and see you all tomorrow.